Welcome everyone to day 3 of the 7th World One Health Congress. Well done for getting here at first thing on day 3, so well done. All right, my name is Hannah Clapham and I'm from the Source Weehawk School of Public Health here in Singapore, and it's my absolute pleasure to be here today to MC this session. This morning's agenda is diverse. We'll start with lessons learned from COVID to improve outbreak preparedness and response, move to unpacking social and environmental determinants of One Health risk, followed by discussion of global vaccination and diagnostic access. Our first speaker today is Dr. Anders Nordström. Dr. Nordström is currently the Swedish Ambassador for Global Health at the Ministry of Foreign Affairs. He has over 2 decades' experience supporting global health issues with WHO, the Global Fund, and others. This morning, he'll be discussing the recommendations from the Independent Panel for Pandemic Preparedness and Response on how to better respond and prepare to outbreak threats. So, Dr. Anders, please.
Good morning, everyone, and thank you for making me 10 years younger. I've actually been doing this job now for 34 years, so appreciate for that. I hope everybody had a good evening yesterday, and I believe we had some excellent sessions yesterday that at least I appreciated a lot. What I'm going to do this morning, I'm going to share some of the experience from what was called the Independent Panel on Pandemic Preparedness and Response. I had the pleasure and privilege of heading the secretariat for this panel. And I'm going to take you through a little bit of background to the panel, the key recommendations, and mostly about the key findings. The report was published now almost 1.5 years ago, but I still believe that both the findings and, even more importantly, the recommendations are still very much valid. And I will come to that at the end, still not implemented. So the panel was established by the WHO Director General, Dr. Tedros. He took, I think, a very good and brave decision to appoint 2 co-chairs, 2 very strong ladies that I had as my bosses, the former Prime Minister from New Zealand and the former President from Liberia, Ellen Sirleaf-Johnson and Helen Clark. He gave them also the authority then both to pick me, the head of the Secretariat, without his interference, sort of, and the same thing with the panelists, even more importantly. So we had 11 brilliant panelists with different backgrounds, seniority, and also competencies. So very quickly here, Mauricio Cardenas, former Minister of Finance from Colombia, Abdi from the African Union Youth Envoy, Mark Dybel, former head of PEPFAR, Michel Kashachkin, former French ambassador and professor and head of the Global Fund, Joan Liu, former president of Doctors Without Borders, MSF, Precious Matuso from South Africa, Director General from there, David Miliband, former Minister of Foreign Affairs from the UK, Thoraya Obaid, former head of UNFPA, Ernesto Cedillo, former President of Mexico, Priti Sudan. She had just stepped down then as the Secretary of Health in India, so she had been leading a lot of the response in India, and Professor Nansung from China. I think he's known as, in some way, the father from SARS, and he had been one of the persons first in Wuhan after discovery of those cases. So a brilliant, fantastic panel, not too big, and they were extremely engaged in all the work. As I said, the Director General got this task from the World Health Assembly in the year 2000, so this came early. This is early days of the outbreak and of this pandemic. And the panel was established then by appointing the co-chairs during the summer. We had the first meeting with the panel in September, and less than 8 months later, we were then delivering our report, or I would rather say reports. It was one main report that I think many of you have seen. It's been widely read and I would say appreciated. It's a non-UN style type of report, and people appreciate it for being possible to read and in a quite forceful way, good language and strong messages and very clear conclusions. There's also another paper which is called, let me see where I've got that now, You have got it up to the right here. How an outbreak became a pandemic. Those are 13 defining moments, and if you haven't read it, I really recommend that as a reading. 13 quite nice chapters understanding what happened during those first 7-8 months. And then we publish also the chronology in terms of what happened day by day, almost hour by hour during the first 4 months, both in terms of the epidemiology, but also in terms of actions by WHO and by different governments. I'll come back to that in a second. Key findings. I'll go over those a little bit more in detail in a minute, but just to give you a flavor, the first finding was that the world had been warned, but had not taken action. Second, valuable time was lost. And I'm going to give you a little bit more of details in terms of when and how and what could have been achieved if we hadn't lost that time. Too many countries took a wait-and-see approach, and very few countries took more of what we call an aggressive containment strategy. And unfortunately, we had a number of cases that basically did not believe that this was serious, and they basically devaluated the whole thing and delayed and created a lot of distrust among their populations. And many, many lives was lost because of this. Funding was not available. It had not been invested in preparedness coming to this time, but also funding was not available when it was needed then for especially then to access diagnostic treatment and vaccines. So international financing too little and too late. And also what is important is that what the panel saw was, of course, not just what happened in terms of the response to the virus. Some people might have listened to me yesterday. This pandemic, this crisis was not only about the virus, this was a societal crisis. And so what the panel saw was, of course, how this affected other health services, other essential health services in countries, but also how this affected economies, how people lost their jobs, how children were not able to go to school. I saw one figure that from in the year 2000 at the sort of peak, 90% of children in the world were not able to access this normal education. Big, big issue, and also major impact in the long run. So this crisis was not only about people being affected by the virus. If I go back then and begin then with the first finding, that the world had been warned but was not prepared. I showed this slide yesterday for those of you who were here. This shows number of cases, number of dead people, deaths, 50 days after the first day death in each country on one axis. And then on the other one is how those countries scored at what was called the Joint External Evaluation, making an assessment of the capacities in countries to be able to cope with this kind of situations. And you can see that there is no correlation whatsoever, or it's rather the opposite correlation. The higher you scored, the worse you did, with a couple of exceptions, and those being Singapore being one, Japan being a second, and Australia being a third. But the rest, you can see that there is a reverse correlation here in between how you scored and how you did. So most likely we were measuring the wrong things, or countries, despite the fact that they thought that they were prepared, they were not prepared. Second finding was that time was lost. And time was lost at, I would say, 3 stages of those first 3 months. We did a detailed chronology that has been published in The Lancet in terms of what happened around Christmas, the first 41 cases being identified in Wuhan on the 31st of December 2019. Those are reported by the Wuhan authorities. WHO is requesting information then from China about those, and on the 4th of January, WHO is then sharing the information with the world. So there was a couple of days lost, but not severe. I mean, according to the IHR, a country is requested to report according to paragraph 10 in the IHR within 24 hours. So a bit of time was lost. More time was lost then coming up to the next step. And that was when the Director General then was obliged, according to the revised IHR, then to get to seek the advice from the Emergency Committee of IHR. They met on the 22nd, 23rd of January, and they couldn't come to a conclusion whether to recommend to the Director General to call this and to inform the world that this was a public health emergency of international concern. No conclusions, half-half, 50-50. He asked them to come back, so they came back a week later, 30th of January. And at that time, they advised him that this is a major concern. You should declare this a public health emergency of international concern. And he waited until their advice. He was not obliged to do that, but he did that. You should know at that time, end of January, basically what had happened in Wuhan, Chinese authorities had taken prompt action. So the curve here had gone down in terms of cases. And there were 98 cases in the world at that time. 98 cases, not more. Did countries across the world react? No. It was not until the Director General of WHO used the word pandemic on the 11th of March, and when especially countries in Europe and in the US saw the hospitals being filled up in Italy, that countries began to react. So it was last month of February. That was the main conclusions from the panel, that was the main delay, that countries did not understand the signal from WHO as the Director General told the world on the 30th of January. So it was basically a couple of days, then a couple of weeks, but then it was almost 3 months after the first cases in Wuhan that the world actually began to react. 1 year later, 30th of January 2001, we had 100 million cases in the world from 98. This was the meeting of the Emergency Committee when they couldn't agree. And then they met again then, on the 30th of January, and then they informed the world. What the panel also found was that the way that politics played in here was not very helpful. The geopolitical tension here, and especially in between the US and China, was quite problematic. And also that there was not a place, a body, where you could talk about the situation and having some sort of political agreement. It took months before the Security Council actually could agree on a resolution and saying that this was a major global health threat and a security issue. Mainly because the US blocked this because they refused to use the word WHO in the resolution. So the geopolitical situation here really was difficult during this time. We have a difficult geopolitical situation right now, but it was at that time as well. And this was one of the key findings that led also to one of the key recommendations from the panel. So too many countries took a wait-and-see approach. We did 28 country studies. We looked at the 7 best cases and the 7 worst cases, and then we picked 14 countries in the middle. And the one who was leading this was an associate professor from London School and from the Singapore University here, Helena Lilgido-Quickly, with a group of PhD students and colleagues across the world. I think we had 25 people involved in this work. It has been published in the Nature, the outcome of those studies. I already, again, yesterday shared the main messages here that the countries that really did the worst were the ones that devaluated science, policy, facts, that denied that this was something, the delays, and also injected distrust in the population. I think from a One Health perspective, and again, I said this yesterday, you can see what the countries that did the best, according to those studies, was, if you look at scientific advice and governance and leadership, evidence and research was taken into account that it was used. It was used in a multidisciplinary fashion. Governments acted in a multidisciplinary fashion. You had committees that worked across governments. You had involvement of communities. So if you look at that, I think there's a lot that one can build on here if you really would like also now to take forward a One Health approach as a way forward. But there were also some success. The health workers were the heroes. So despite the very difficult situation, in very many cases, in very many countries, the health workers did an absolutely fantastic work and worked around the clock. The access to data and research, the sequences of the genome was done already on the 2nd of January, the first year. It was published on the 11th of January. Record speed and also record openness from the Chinese authorities actually sharing this with colleagues across the world. The vaccine was also developed in an unprecedented speed, and I'll show you a slide on that. And also, of course, there was successful national response. And what was interesting was that that was not related to the level of wealth. There were other countries that were actually more successful than the richest countries in the world. The health workers were really the heroes, as I said. I think it's interesting. I don't know whether there is a case study from India. They did quite well on the first wave. On the second wave, they were quite badly hit from the Delta variant. There was a huge lack of oxygen. They rapidly changed the whole sort of use of oxygen in India to be able to have access to oxygen in the hospitals. The way that they did that, I think, should be both recognized and documented so that we better understand how they could, in that huge country, do that. This is just a slide showing then different vaccines, how they were developed, and this vaccine was then developed in a record speed with, I think, both some pros and cons coming with that. The big issue was, of course, then what happened with the access to the vaccines. They came very quickly. The rich countries in the world had entered into agreements with the vaccine industry and had basically saved, or what should we say, taken care of 5% more vaccine than what they needed for their populations. I saw a study quite recently that if vaccines had been available as we recommended from the panel immediately then in September, August 2021, we could have saved 1 more million of lives. I don't know whether it's true or not, but definitely this was a major issue that we need to deal with in the future. So the recommendations from the panel. The first recommendations, and remember this report came then in May 2021, was really then to make sure that vaccines were available. Even if I was saying both today and yesterday that vaccine is not the only thing, but it was an important tool and is still an important tool. So the recommendations was to really make sure that you redistribute the vaccines that are available and make sure that financial resources are there. It did not happen that quickly, and again, lives could have been saved. Now it's available, but too late. Recommendations for the future from the panel. The first recommendation was then based on the lack of a platform to be able to have political agreements and to be able to politically support what was needed, was really to elevate global health threats at the highest level. So one of the key recommendations from the panel was then to have a Global Health Threats Council, to establish that under the UN General Assembly. There were other suggestions to establish it under the G20. The panel did not support that because they believed it needed to have the support from all countries across the world, and it needed to be something beyond health. So it could not be established by the World Health Assembly, but it needed to be established by the General Assembly in New York. That was the recommendation by the panel. Similar recommendations had been made in a previous commission that after the Ebola outbreak by President Kikwete, it never happened. So I said that the world was not prepared, but it had not listened. We reviewed 16 previous commissions and panel reports. And basically a lot what we were saying had already been said, but no action had been taken. So that had been said before, no action. The second recommendation was then to establish then a new international legal framework, a pandemic convention. One of our co-chairs, Helen Clark, she said, after the Chernobyl, we had a new convention in terms of how to deal with the spread of nuclear material. That convention was established in 6 months. We should do it in 6 months here as well. We still are not. We haven't seen the first draft yet. We will have the first draft, I believe, now on the 20th of November. So unfortunately, it's on its way. Question is whether it will be sharp enough really to support a better response next time. The panel's recommendation was also to give more independence and authority to WHO to report immediately, not waiting for countries to provide their approval for WHO to report. According to paragraph 10, WHO needs to request there is 1, 2, 3 times the member state before they can inform. Then number 4, they can inform even if they don't have the approval of the member state, but that is rarely happening. So the recommendation from the panel was that because the information is already out there through social media and other means, that WHO should be authorized to immediately to report and to inform the world. The second recommendation was also to allow WHO to visit the site with a verification mission. The first mission happened 1 month after the outbreak from the WHO country office in Beijing, only 2 months after the outbreak from an international mission around the 20th of February. I've been saying to my own country, Sweden, if we have an outbreak in Malmö, we should welcome WHO to come to Sweden and check what this is and to tell the world whether this is something they need to worry about or not. This should be in the global interest of everybody to be open and to welcome a mission from WHO to verify what this is or not. Openness and transparency and giving that authority and also independence to WHO. Third recommendation was then to invest in preparedness now, not when the next outbreak is happening. I was the head of the WHO country office in Sierra Leone during the Ebola outbreak. We invested in Sierra Leone, in the poorest country in the world, in the future, developing new integrated disease surveillance systems as the Ebola outbreak was still ongoing. Are countries doing that across the world today? Reorganizing the system, investing in the preparedness for the next outbreak? No, my country is not doing that. And we will have a new outbreak, there's no question about that. Having a better surveillance and information and sharing platform, that is partly happening, and there's a lot of technology that is now being made available, and there's a lot of international collaboration around this area. But again, the authority of WHO is critical here. One of the main issues that are being discussed right now, what is going to be the future platform to be able then to develop rapidly, quickly, and with access to all countries in the world for diagnostics, treatments, and vaccines. So there are big evaluations going on around Act A and on COVAX. This is going to be a critical element for the design of the future system so that we more rapidly can have possibly not everybody equal sort of access, but having a flow of access to the products, to the ones that needs it most, where we will have the most public health impact. And that this time we did not have that, because we couldn't have politically an agreement on the flow, and we didn't have the necessary financial resources available. So the panel recommended what was called an end-to-end platform to be put in place, not necessarily a formal organization, but a process where that has been pre-negotiated and agreed. We discussed yesterday afternoon about the need for financing. The panel's recommendations was very clear: invest in preparedness, but also make sure that we have quick money available quickly, rapidly, when an outbreak happens next time. The recommendations was that there is a need for something in between 10 and 15 billion US dollars, a lot of money. Compared to what this pandemic has costed, it's absolutely nothing. The panel's recommendation was that this was not going to be aid, not development assistance. This was going to be more of a financing of a global insurance, a global public goods, that all countries should finance according to a burden of sharing, according to ability to pay. We have now put in place what is called a fifth. That is not what the panel recommended. This is aid money competing with other needs, and it's too small. It's about 1.2 billion right now, when we don't know what the future will be. So there is a need for more money, but different kinds of money, and this is really a message to the Minister of Finance. This is a good investment for the future. And finally, of course, we had a number of recommendations to national governments. Most important, the panel focused mainly on the international system. We started with WHO, but then looked at the international system at large, and then, of course, WHO. But most importantly is, of course, what is happening in countries. The international system is only there to support what national governments are actually doing. And one of the recommendations was to elevate the status of what is today called the IHR focal points, to have a national pandemic coordinator at a much higher level in governments. Some governments appointed somebody who was really the general to take the lead, but that needs to be in place also not just in a time of war, but also in a time of peace. So the panel was quite clear that if this package of recommendations were implemented, there is a possibility not to have the next outbreak to become a pandemic with the same consequences. We will have a new outbreak, no question about that. Can we avoid a pandemic? Possibly. Can we avoid a pandemic with those consequences? Yes, if we learn and if we establish some of those, as I see it, quite simple means. The recommendations are not difficult, and if we are not doing this time, having lived through this now for 2.5, almost 3 years, when are we going to do it? Unfortunately, the panel concluded in its one-year report. The panel has ceased to exist, but they still came out with a report with the title Transforming or Tinkering Now in May this year. And basically the message was that the world is still tinkering. There's a lot of processes, but there's no real transformation. There's no real decision to authorize WHO to have more power. No real decision to put real money on the table. No real decision in terms of what should be the future platform to have access to vaccines. No decision to establish a political platform to be able to avoid the political tensions that we had this time. A lot of material is available, the main report, 16 background papers, a lot for researchers to dig into, all of this with annotations, references. We published one paper in the Nature, one in the Lancet, and a series also in the BMG about our findings from especially the country work. Thank you very much.